Vascular patterns, part 3. We've already talked about vessel morphology. We talked about dotted vessels, clots, vessels as lines, and how these different types of vessels form different types of patterns. And we also talked about vessel arrangements within the patterns. And now we want to use vessel morphology and arrangements to come to specific diagnosis with dermatoscopy for unpigmented lesions. And here are some examples. The clinical first. It's a clinical image of an unpigmented, slightly elevated plaque. It's scaling, and here's the dermatoscopy. What type of vessels do you see? Well, you see only one type, and these vessels are dots. Here, 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 dotted vessels. So this is a monomorphous vascular pattern that consists of vessels as dots only. How are they arranged? Well, the arrangement is non-specific. They are all over the place. So what do we have? We have a monomorphous vascular pattern consisting of dotted vessels only that are not arranged specifically, and we have a clue of scaling. This computes to the diagnosis of psoriasis. There is no other diagnosis. Here clinically a similar lesion, and we can see scaling again, unpigmented plaque. Dermatoscopy, we see again dotted vessels here and here and here, but there are also some larger dots that may be coils. So we have a polymorphous vascular pattern. Sometimes it's difficult to differentiate between coils and dots, but what it's not so difficult is that the vessels here are arranged specifically. We can see clusters. Here there is one cluster, there is another cluster, so the density of the vessels varies between parts of the lesion. So this is different from psoriasis plaque I showed you before. And we have some scaling here again. The diagnosis here is not psoriasis, it's Bowen's disease, intraepidermal squamous cell carcinoma. Another example here, unpigmented lesion, slightly elevated. Clinically you can see a peripheral rim, and you may already suspect the diagnosis of porokeratosis. How does it look like dermatoscopically? One pattern, dotted vessels only. Well, there are some linear vessels here, but you can disregard that. The main pattern here is dotted vessels, and we also see a peripheral rim. This is the porokeratotic rim that is so typical for porokeratosis. So the diagnosis here is porokeratosis. What's important is the vascular pattern of an inflammatory disease. Dotted vessels, no specific distribution. Porokeratosis. Here this is out of focus clinically, but doesn't matter. Dermatoscopically it's important. We don't have dotted vessels, now we have linear vessels. And what type of linear vessels? Well, the type is serpentine because there are multiple bands. Are they branching? We don't know. Some are branching, but it's not typical. What else do we have? We have some clues to basal cell carcinoma, gray clots, but also ulceration. So in combination, a vascular pattern consists of serpentine vessels. Some of them are maybe branching, and other clues to basal cell carcinoma. The diagnosis must be basal cell carcinoma. Sometimes you do not see the typical branched vessels, especially for basal cell carcinomas on the trunk, flat basal cell carcinomas. Here is another example. You can see clinically ulceration. You suspect basal cell carcinoma. Dermatoscopically at first blush it's difficult to see which type of vessels are present, but if you look closely you can see that they are linear here and here and here. Some are straight, but some are not straight, some are serpentine, like here you can see serpentine vessels. And again we have the same pattern as seen in the basal cell carcinoma before, and we have the same clues. We have clots, and we have ulceration, and we have white lines. White lines are not specific. They can be found in melanoma or basal cell carcinoma or other malignant lesions, but the diagnosis here, according to the vascular pattern and according to other clues, is basal cell carcinoma. This is another slightly elevated plaque, unpigmented. Which type of vessels do we see? Well, we see a polymorphous vascular pattern, dotted vessels, coiled vessels, and linear serpentine vessels. What is important is if in a flat lesion a polymorphous vascular pattern consists of dotted vessels plus other vessel types, you should think about melanoma, even in the presence of gray clots. Gray clots can be found in basal cell carcinoma, but also in melanoma. This is a melanoma. Another example, clinically, dermatoscopically, which type of vessels do you see? Is it monomorphous or polymorphous? It's easy, it's polymorphous. You see one vessel type here that is different from the other vessels. These vessels are dots, and here these vessels are lines. What type of lines? Some of them are coiled, some of them are serpentine, doesn't matter. It's a polymorphous vascular pattern that consists, at least in some parts, of dotted vessels, which indicates the presence of melanoma. What else speaks for melanoma? Here we can see an eccentric structureless brown area, which is another clue to melanoma. So the diagnosis here is melanoma. Now some nodules, clinically easy, again, basal cell carcinoma, and this is confirmed dermatoscopically. Which type of vessels do you see? Well, they are linear and they are serpentine. They are multiple bands, and some of them are branched, so the arrangement is branched, so the diagnosis is basal cell carcinoma. This was easy. Another nodule here, clinically and dermatoscopically, the same pattern of vessels, serpentine, branched vessels. They're a bit out of focus, not so sharp, demarcated as shown in the examples before, and some white lines. White lines are not specific, but may indicate a malignant process. So what's your diagnosis? Again, basal cell carcinoma, but take care, because not every lesion with serpentine branched vessels is a basal cell carcinoma. This is a malignant peripheral nerve sheath tumor. And whenever you have a nodular lesion where the vessels are arranged in a non-specific pattern, or where the vessels are arranged in a way that they are branching, then you have to excise it.